The miracle of science has given a lot of us longer lives, and so 1/3 of a woman's life may be spent in the menopause. So all the ladies and the people around them need to know more about it, because they will all have to deal with it. Menopause is when the menstruation pauses. That means the periods stop permanently. Why does that happen? Why does a woman have a menopause? Women are born with a limited, finite number of eggs, and this pool of eggs is used up over time, and then it finishes. And once the eggs finish, the menstruation finishes and the menopause starts. So a few years before menopause are the years where there is perimenopause. So I would briefly go into both of them and what happens during this time, and then what happens later. So when does menopause happen? The average age is about 52 years, but in different families, different ages of menopause have been seen, starting from 45 to even 58, 59 years. Natural menopause. If the menopause happens before, say, 40 years of age, then it is premature menopause or premature ovarian failure, and that has its own set of problems. But we are now talking about the normal menopause, the ending of menstruation. So a few years before the actual menopause, the periods start becoming irregular, and very important, the women who experience this perimenopause start experiencing different changes physically, mentally, and emotionally. The physical changes may be difficulty in losing weight, maybe other joint pains and body aches, things like that. Things that they didn't have before start appearing. Mentally, they may be experiencing brain fog, short-term memory issues, lack of concentration. Emotionally, irritability, mood swings, anger issues, and this is even more important that the people around them are fully aware of it, so that they can make some allowances and be there for the lady who's undergoing these changes. Then the hot flushes start. Then the night sweats start. These are called vasomotor symptoms, and they can be physically very draining. We can help here. We can give hormones, hormone replacement therapy, and we can do it very safely so that you can go through this transition comfortably. So once the actual menopause starts, that's when these symptoms may actually reach a zenith. If we let this menopause go on naturally and do not interfere with hormones in any way, the hot flushes may carry on for a few months, years, or for good. In some women, they just don't go away. But then other effects start. The estrogen goes down, the skin, the hair, the heart, and of course the bones. The biggest effect is seen in the bones. The bones become thin. This is called osteoporosis. What happens because of osteoporosis? Fractures. These are called fragility fractures. A little fall and you hear of this grandmother breaking her hip or her thigh bone. This is because the thinning of the bones that happens because of menopause. So what can we do to help? We can give hormones, and safely. There is this tremendous fear that hormones are going to cause cancers. No, the very, very, very minute risk that has been seen in some studies is absolutely negligible as compared to the quality of life that's being compromised and the risk of the fractures and the thinning of the bones. So yes, I'm a great proponent of hormone replacement therapy, and it should be done safely by screening. And the screening starts with your history. If you don't have a family history of cancer, of clots and some other questions that we ask, or liver disease in a personal history, then we can start you after doing a few other tests. We can then start you on hormone replacement therapy, which we can continue safely till the age of about 60 and even longer. The point is that we give you estrogens and progesterones. The most important hormone that is depleted is estrogen, which is the one that is actually keeping your bones healthy. But when estrogen is depleted, the brain starts secreting other hormones to stimulate the ovaries to produce more estrogen, and these hormones then cause these hot flushes. So when we give you the estrogen, the hot flushes go away, the skin and hair look is better, and the bones remain healthy, right? So this is a transition every woman is going to go through. I just don't want you guys to be afraid of using hormones. They can really, really improve the quality of your life, and these were just the physical effects. Of course, the mood swings are better, the memory is better, the concentration is better. So I would strongly recommend that you use hormone replacement therapy under supervision of your doctor, who is there to ensure that all the pre-checks are done and the lowest effective dose of the hormones is given to you, so that you don't have any of the side effects. So if you are having any of the problems of perimenopause or menopause that I have mentioned, please see your doctor. Please come and see me. When you come and see me, I will ask your history. I will ask you what is bothering you. I will look at your medical history, any surgeries you've had, any medical issue that you're undergoing. Maybe you have diabetes, maybe you have high blood pressure. I will look at your body weight. I will look at your height. I will look at your family history of cancers. I look at your complete lifestyle, what kind of diet you have, what kind of exercise you do. Then I'll run a few tests, which include liver function tests. I will do some ultrasounds, maybe an ultrasound pelvis to look at your uterus and ovaries, an ultrasound breast, maybe do mammography if you've not had one. And once I've had a complete medical picture, you and I will sit down and we'll discuss your needs and what I can offer you. I will guide you through the process of hormone replacement therapy. I assure you, I do not start this therapy unless I'm very sure it is safe for you, and even then, I will call you on annual visits where I will reassess your hormone requirements, do follow-up scans, follow-up tests, and make sure you stay safe while using these hormones. Thank you.